So a heart attack is when you have a blood clot in the arteries that supply oxygen to the heart, and it causes the heart muscle to, in essence, scream out in pain, which is what gives you chest pain, gives you shortness of breath, and the only way to fix it is to come into the hospital and either have the clot sucked out or the artery where there's a narrowing opened with a stent. So it's definitely a trend that is noticed that colder weather, for whatever reason, incites heart attacks. I don't think the biology of it has been proven, but theories exist that it causes more vascular spasm of the arteries leading to the heart, and that if you had a narrowing in the blood vessel or a clot that formed in the cold in the wintertime, there's more spasm of that artery, and so it can lead to earlier detection of that heart attack. So there are traditional factors that put you at risk for heart attacks, the number one being age. So as we get older, the risk gets higher for having a heart attack. So typically people in their 60s, 70s, and 80s are at the highest risk. But smoking is probably the one reversible risk factor that puts you at the highest risk for having a heart attack. There are also other factors like diabetes, high blood pressure, high cholesterol, as well as family history. So if your mother, father, or any first-degree relatives, brothers or sisters, have had heart attacks in their younger years, that may confer an increased risk for you in a genetic way. So certainly diet and lifestyle play a big role in putting people at higher risks for heart disease. Unhealthy diets filled with foods that are high in simple carbohydrates like sugary drinks, sugary desserts, and other snacks found in the grocery store, that puts you at risk for diabetes, obesity, as well as eventually heart disease and strokes. So certainly the traditional signs and symptoms involve chest pain or chest discomfort, often described as a heaviness in the chest or like an elephant sitting on the chest. Those are some of the traditional symptoms, but a patient can have a variety of symptoms, including just shortness of breath, nausea, feelings like heartburn, because oftentimes some of the blood vessels that go to the bottom part of the heart sit next to the diaphragm and the stomach and can mimic heartburn or acid reflux. And so it's important that even if you're not having the classic symptoms of chest pain, that if any pain is going on for longer than 15 to 20 minutes, is not treatable with just over-the-counter medication and seems to be getting worse, it's probably advised to seek medical care at that time. So if a heart attack is occurring, the most important treatment is to open up the blood vessel that is clogged, either with the clot or a narrowing in the blood vessel. And usually that's done with a stent at the hospital. That can happen immediately, and the urgency of it depends on the severity of the heart attack, whether it occurs the minute that the patient gets to the emergency room or other testing is needed in the hospital to then determine the appropriate care. So probably the first thing to do is to call 911 if there's any concern of a family member or friend or a nearby person having symptoms of a heart attack. And then while awaiting medical assistance, if aspirin, a baby aspirin is available, it's advised to take 4 baby aspirins chewed and swallowed in order to potentially initially medically treat that clot that's forming in the artery of the heart. So preventing heart attacks involves identifying which of those traditional risk factors that you may have. And a lot of that involves just a simple check in the doctor's office or some simple blood tests, and identifying which of those specific risk factors are putting you at the highest risk for a heart attack. So whether it's treating your diabetes or your high blood pressure or your cholesterol. But then I think it's also a big part of it is addressing what are the habits that you have in your daily life that may be putting a risk for you that isn't identified in a blood test or with a doctor's visit.